Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cellular aging. Cellular aging is the result of progressive decline of cellular function and viability caused by cellular abnormalities and the accumulation of cellular and molecular damage due to the effect of exposure to exogenous influence. So exact definition is difficult to say, but this is the most defined statement about cellular aging. People don't like to be aged. People like to be young forever. This was practiced in the Egyptian civilization many years back, also in Greek, including their mythology. So there are some deity, they were advocate for youth forever. So we'll go through the cellular aging. Individual age because their cell age. Our body is composed of cells. If our cells are aging, then we will be aging, we'll be old. Age is one of the strongest risk factors for many chronic diseases. So we have a department, geriatric department in almost all hospitals, and there are some typical diseases of the old people, like that of the Alzheimer's disease. This is also very common among the patients who live in the hospice. Parkinson's disease and ischemic heart disease and many other diseases like gout, like dermatomyositis, many diseases. Age is the strongest risk factor for those diseases. Okay. Aging is influenced by a limited number of genes, genetic anomalies, and syndrome. Intrinsic cellular and extrinsic environmental factor interplay in the aging process. External factor, suppose a person is exposed to sun all the time, like the cultivators or the farmers in India. Okay, so they have very early aging process. At the age of 40, they have cataract of their eyelids. Their skin become very much folded because they are exposed to the sun ray, and a lot of them work without a hat. Okay, so like that, environmental factor like sun, one of the important environmental factor, interplay in the aging process. Also nutrition, very important factor. Some type of nutrition deficiency enhances aging process. So nutrient and also the vitamins are very important to prevent certain type of aging process. Okay, so if we look at the aging process here, mechanism that causes and counteracts cellular aging. Number one, DNA damage, carcinogen exposure. Okay, sporadic errors. Then this is the reactive oxygen species exposure. Okay, that lead to DNA damage. Okay, so we got that. Here, defective DNA repair. Our cell has also DNA repair system, but if it is defective, there will be mutation and there will be cell loss, there will be cellular aging. Okay, here this is the DNA damage. Another mechanism is cellular replication is decreased because of telomere shortening. Telomere is the terminal part of the chromosome. Okay, so if this is a chromosome here, okay, one, okay, if we have centromere here, if we chromosome. Okay, so this is the telomere. This is another telomere, terminal part, telomere here. This is telomere, and telomere is supported by telomerase enzyme that provide the nucleotide. Okay, so this is important for the cellular replication. If it is very short, there will be no or less cellular replication. Telomere shortening and non-function of the telomerase. There will be decreased cellular replication. As the age advances, cell has limited number of replication. Cellular replication is present in the children, but as the age advances, decreased cellular replication because of smaller size of the telomere. This is telomere. Okay, this is telomere. This is telomere. Okay, this is telomere. So you got that telomere. Oh, okay. Okay. So then cellular replication will decrease. Then there will be cell loss, and it is a part of cellular aging. Then defective protein homeostasis. Okay, not decreased normal protein. The mitochondria may not function properly. Okay, the DNA there is defective. Damaged protein is accumulated in our system. Decreased cell function that lead to cell loss. Okay, these are all associated with aging. We have other way here, nutrient sensing. Idea is that if we can control the calorie intake, if we have little less calorie intake, then we can prevent aging. Okay, in this way, decrease insulin growth factor signaling. So it will decrease the metabolism of the cell, and cellular damage will be retarded, will be delayed. Cellular damage will not be instant. Or if there is decreased insulin or insulin-like growth factor signaling, so that will prevent cellular damage and prevent aging process. Like that, TOR is target of rapamycin. If it is decreased, that is also important to decrease the cellular aging process. Altered sirtuins. This is important. We like this. This should be more, so that it stimulates multiple genes. It is anti-aging, and very good news is that this is present in the red wine for some reason, and it is told that if the people take limited amount of red wine, he may prevent aging because that contains sirtuins. Okay, so nutrient sensing or regulating the calorie intake, it can prevent altered transcription. Okay, so it will cause increased DNA repair, increased protein homeostasis. So we'll get normal protein, will not get defective protein in your system. If we go to this picture from Robin's pathology, 10th edition, okay, telomeric length is very much in germ cells, in the stem cells. Okay, stem cells are present in many parts of our body, including the bone marrow. Okay, somatic cell, as the age advances, it loses the telomeric length. Okay, so growth is arrested, so cell will be damaged or lost. In cancer cell, the telomerase activity will come back again. The telomere will not be decreased in cancer cell, so telomere length is going to be increased like this. Okay, in this way. Okay, so these are the importance of telomere. Telomere is here, the terminal part of the chromosome. Okay, so if we go to the probable cause of aging, again we'll go to the DNA damage. That may be extrinsic, may be intrinsic. Even some type of viral infection may lead to DNA damage. some fungal infection may cause DNA damage. Physical, chemical environment may cause DNA damage. Exposure to that of the nuclear explosion or like that of the radiation that may cause DNA damage. Cellular senescence, we have just discussed that cell loses their replicative capacity because telomere becomes shorter and shorter. Telomerase does not work. Telomerase does not add the nucleotide. Okay, telomeric attrition. Activation of tumor suppressor gene is also important. Activation tumor suppression gene is associated with aging process. Okay. Then defective protein homeostasis is another factor. Protein homeostasis is not good. Dysregulated nutrient sensing. We have just discussed insulin growth factor that should be decreased. But we like this sirtuin. Sirtuin present in the red wine. It has many benefits. It is anti-aging, but although there is no pill in the market, but sirtuin is on the research way, so that we'll get sirtuin in some type of pill one day. Okay, so we got that. So these are the probable causes of aging. Okay. Okay, and that's all about the cellular aging. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.